What I am about to share with you today has the potential to change the way you think about your heart, your arteries, and everything you have been told about keeping them healthy. My name is Dr. Joseph, and I have spent more than 20 years as a cardiac surgeon. I have opened thousands of chests. I have held calcified vessels in my hands. I have seen plaque turn arteries into something resembling concrete pipes. And I can tell you with complete certainty that almost everything you have heard about how to clear your arteries is wrong. The internet is full of dangerous MYTHS, lemon water to dissolve plaque, apple cider vinegar to clean your vessels, garlic capsules to melt cholesterol. These are not just ineffective, they are a distraction from what actually works. Your arteries are not pipes, and plaque is not grease stuck to the walls. You cannot swallow a chemical and flush it away. I know this because I have seen with my own eyes what truly happens inside a diseased artery. Every time I open a chest for a bypass, every time I cut into a coronary artery blocked at 90%, I study the pathology, the biology. And it is always different from what people imagine. Plaque is not cholesterol stuck like fat on a drain. Plaque is an immune reaction, an inflammation. It is your own white blood cells attacking oxidized cholesterol trapped inside your vessel walls. It is a genuine autoimmune war happening silently inside your arteries. If you want to reverse this process, you must first understand the mechanism behind it. Because once you understand what plaque truly is, how and why it forms, you will grasp that the meal I am about to describe is not a natural health myth but a targeted biological intervention. Every ingredient activates a specific pathway. Every compound triggers a defined cellular response. This meal does not clean your arteries by magic. It activates reverse cholesterol transport. It forces your immune cells to eject the cholesterol they have engulfed. It prevents calcium from turning your vessels into bone. It blocks LDL oxidation at its source. This is cellular biology, this is immunology, this is how plaque is reversed, not through a detox cure, but through science. Before we go further, and trust me, you will want to stay through to the very end because what comes next is the part most doctors have never explained to you. Let me make sure you understand the enemy. Your arterial wall has 3 layers. The innermost layer, called the intima, is a single sheet of endothelial cells. These cells form a barrier between your blood and the deeper layers of the vessel. When healthy, they are smooth, slippery, and they produce nitric oxide, a gas that dilates the vessel and prevents blood cells from sticking. But when these cells are damaged by high blood pressure, smoking, diabetes, or chronic inflammation, they become dysfunctional. They stop producing nitric oxide, they become sticky, and they develop microcracks. Through these cracks, LDL cholesterol particles infiltrate the wall. That is the first step in plaque formation. The LDL crosses the endothelium and becomes trapped inside the intima. Then the critical step happens. The trapped LDL oxidizes, attacked by free radicals inside the vascular wall. It is like rust setting in. The fats inside the LDL go rancid, the proteins are damaged, and the particle transforms into oxidized LDL. Your immune system recognizes this oxidized LDL as an enemy, as if it were a bacteria or a virus. It sends in its troops. Monocytes penetrate the wall, slip through the endothelium, and transform into macrophages, the garbage collectors of the immune system. Their mission is to swallow and eliminate the waste. The macrophages engulf the oxidized LDL, but they cannot process all that cholesterol. They suffocate, they swell, they fill with fat, and they transform into what we call foam cells, immune cells gorged with fat that look foamy under a microscope. These foam cells are the foundation of plaque, the first visible sign of atherosclerosis. When autopsies are performed on teenagers who died in accidents, thin yellow streaks are often found on their arteries. Those are millions of foam cells already gathered there. The disease starts that early. And what is tragic is that these cells are trying to protect the body, trying to eliminate the oxidized LDL, but they become trapped. They cannot exit the wall or return cholesterol to the bloodstream. They stagnate, bloated and dying, and when they die they rupture, releasing their contents, cholesterol crystals, enzymes, inflammatory molecules. This triggers even more inflammation, attracting more macrophages, creating more foam cells, and the plaque grows and grows over years, even decades, narrowing the blood flow inside the artery. Symptoms begin to appear: chest pain, shortness of breath, cramping in the legs while walking. But the greatest danger is not the narrowing, it is plaque rupture. Plaque is not a solid, stable block of cholesterol. It is a dynamic inflammatory lesion covered by a thin cap, hiding a core of dead foam cells and debris. That cap is fragile, and when it breaks, its contents are released into the bloodstream, triggering an instant blood clot. No surgery needed. Now let me give you the exact meal protocol. This is not a recipe, it is a targeted intervention. Every ingredient has a specific purpose and activates a precise biological pathway. The first component is a nitrate donor, arugula or beets, ideally both. Your endothelium produces nitric oxide, which dilates vessels, prevents blood clotting, inhibits plaque formation. In atherosclerosis, this production is compromised. But there is a pathway to restore it through the nitrite-nitrite-nitric oxide route. You eat nitrate-rich foods, the nitrates are absorbed, oral bacteria convert them to nitrites, and the endothelium converts those to nitric oxide. This only works if you protect those oral bacteria. Mouthwash destroys them. Chlorhexidine, antiseptic rinses, all of them eliminate the bacteria that keep your arteries healthy. Brush and floss, that is enough. You need 300 to 500 milligrams of nitrates daily, that is 2 to 3 cups of raw arugula or 1 large beet. Do not cook it, heat destroys nitrates. Chew slowly to maximize salivary conversion. The second component is extra virgin olive oil, rich in phenols, especially oleocanthal, the compound responsible for that peppery throat-burning sensation in high-quality fresh oil. Oleocanthal is a natural anti-inflammatory that inhibits COX enzymes just like ibuprofen, calms vascular inflammation, stabilizes plaque, and most critically, increases ABCA1 production, directly stimulating the extraction of cholesterol from foam cells. The landmark Spanish per diem study showed that subjects supplementing with 50 milliliters of extra virgin olive oil daily had 30% fewer cardiovascular events compared to the low-fat diet group. Use cold-pressed, dark glass bottle, recent harvest, minimum 250 milligrams of polyphenol per kilogram. If it does not burn your throat, it is not working. 4 tablespoons per day. The third component targets calcification reversal through vitamin K2, specifically the 7-Malawian Quatches form. K2 activates the matrix GLA protein, the only molecule capable of blocking calcium crystallization inside vessel walls. Without K2, MGP is inactive and calcium deposits accelerate. The richest natural source of 7-Malawian Quatches is natto, Japanese fermented soy. Japanese studies confirm that regular natto consumption reduces arterial stiffness, calcification, and cardiovascular risk. Eat 50 grams of natto daily, or if unavailable, 85 grams of aged Gouda or a 7-Malawian Quatches supplement of 182-360 micrograms per day. This is what reversed Thomas's calcium score. The fourth component blocks LDL oxidation at its source using pomegranate seeds. Pomegranate contains punicalagins, polyphenol that wrap around the LDL particle and make it resistant to oxidation. Less oxidized LDL means fewer immune reactions, fewer foam cells, slower plaque growth. Human trials confirm that 1 year of pomegranate consumption reduces carotid artery thickness and dramatically cuts LDL oxidation. 1 cup of pomegranate seeds per day provides 300 milligrams of punicalagins. Use the whole fruit or seeds, never the sweetened juice. The complete daily protocol is simple. A large bowl of raw arugula, 2 to 3 cups, for nitric oxide restoration. 1 cup of pomegranate seeds for LDL oxidation protection. 3 to 4 tablespoons of hyphenolic extra virgin olive oil for ABCA1 activation and anti-inflammatory action. 50 grams of natto or 85 grams of aged Gouda or 7 Malawian kwacha supplement for calcification reversal. Wash and season the arugula, mix in the pomegranate seeds, drizzle generously with olive oil, salt and pepper as desired. Chew slowly. Salivary contact is critical for the nitrate pathway. Never use mouthwash. Never skip the oil out of caloric concern, it is therapeutic. Never replace arugula with spinach. Excess oxalates interfere with calcium absorption. Your doctor likely does not know this because medical education contains fewer than 20 hours of nutrition across 4 years of training. The system is structured to treat disease, rarely to reverse it. Atherosclerosis is taught as inevitable, managed with statins, treated with stents and bypasses. Reversing it is considered impossible, despite being demonstrated in research. It cannot be patented. It cannot be sold as an industrial product. So the pharmaceutical system fills the space, shaping research, education, and communication. Your doctor is not incompetent, they simply were never taught this, and have no time to update their knowledge under the weight of patient volume and paperwork. This is why the responsibility falls on you to educate yourself, to understand your own biology, and to take back control of your health. Apply this meal every single day. Monitor your progress. Remember that your arteries are not pipes, and plaque is not grease. But you can activate reverse cholesterol transport, stop calcification, restore nitric oxide, and prevent LDL oxidation. You can reverse the disease, one meal at a time, one mechanism at a time, day after day, until the plaque regresses, the calcium score drops, and surgery becomes a distant possibility rather than an inevitable one. That is what I want for you. That is the mission of this channel. Take action today, and give your body the tools it needs to heal itself. The artery is completely blocked. If this happens in the heart, it is a heart attack. In the brain, a stroke. In the leg, gangrene. This is how plaque kills, not through slow blockage, but through a sudden rupture that provokes a clot. And what makes this even more alarming is that the plaque that ruptures is not always the largest one. Sometimes a plaque blocking only 40 to 50% of an artery, one that would have escaped any intervention, ruptures and kills. It is not the size that matters, it is the composition, the level of inflammation, the number of dying foam cells, the thickness of the cap. This is why the standard approach fails. Cardiologists focus on narrowings above 70% to place a stent, believing the problem is solved. But the plaque remains, inflammatory, unstable, always ready to rupture. The stent removes symptoms but does not cure the disease. The smaller, unstented plaques are the ones that kill, because no one treats them or tries to reverse them. We need a completely different approach. Not widening the artery, but stabilizing and reversing the plaque. We need to extract cholesterol from the foam cells inside the vascular wall, return it to the circulation, transport it to the liver, and eliminate it. This process exists. It is called reverse cholesterol transport, and it is the only scientifically proven method to make plaque regress. Before I go further, I want to ask you something important. If this information is already opening your eyes to things no one has ever explained to you, then this channel deserves to be part of your life. Subscribe right now and hit the bell icon so you never miss a protocol like this one. Every video on this channel is built on real science, real mechanisms, real patient cases, not filtered recommendations shaped by the pharmaceutical industry. Your subscription keeps this knowledge alive and reaching the people who need it most. Now, back to the science. Your body already possesses the mechanism for reverse cholesterol transport. HDL cholesterol, often called the good cholesterol, is not good because of what it is, but because of what it does. HDL is a transport vehicle that picks up cholesterol from tissues and carries it back to the liver. When HDL encounters a foam cell, it binds to its surface and activates a critical protein called ABCA1, which acts as an ejection button for cholesterol, pulling it out of the cell and loading it onto the HDL particle. That particle then travels to the liver, which excretes the cholesterol into bile, then into the intestine, then out of the body. The foam cell deflates. The plaque regresses. That is reverse cholesterol transport, the only validated pathway to reverse atherosclerosis. The problem in most people is that this transport is broken. The ABCA1 protein is no longer activated. HDL is dysfunctional. Foam cells can no longer eject their cholesterol. The plaque grows until rupture, or until the patient ends up on my operating table. But this pathway can be reactivated. ABCA1 can be stimulated, HDL function can be restored, and reverse transport can be restarted, not through surgery, not through medication, but through specific foods, precise molecules, ingested together in a carefully chosen combination. Let me tell you about Thomas, a 68-year-old patient with no symptoms whose routine coronary calcium scan came back at 836, severe disease. His cardiologist prescribed a high-dose statin, a low-fat diet, and exercise. Thomas followed the protocol strictly for 1 year. His score climbed to 981, 145 points higher. Despite doing everything right, the plaque was progressing and calcifying. He came to see me asking if he needed surgery. I told him his lesions were not tight enough for a bypass, but I told him the truth. If he did not reverse course, he would be dead from a heart attack or on my table within 5 years. I asked him to stop the low-fat diet and follow the meal protocol I am about to share with you. He was skeptical. His cardiologist had told him to avoid fats, and here I was talking about olive oil. I explained that low-fat diets lower HDL, and without HDL, reverse cholesterol transport cannot function. Thomas trusted the process, ate this meal every single day without exception. 18 months later, his calcium score was 922, a drop of 59 points. The plaque was regressing. Calcium was being reabsorbed. His arteries were slowly repairing themselves. 5 years later, his score continues to decline slowly.